Hey everybody, I am Dr. Jordan over here at Advanced Spine, and I just want to talk to you guys today about a couple different things. I've had a lot of people calling in lately kind of asking about lower back issues that are radiating down their leg, having pain going down the leg, numbness, tingling, burning, even weakness, having trouble lifting their feet up. And usually there's two main areas that we want to look for this. One, typically it's coming from the lower back. You might have heard we might have a disc issue or a pinched nerve. But a lot of the times we can also see it coming from your sacroiliac joint or your SI joint. And the two big things we have to do is we have to figure out where that nerve's getting pinched at, and then how do we get that pressure off that nerve so that that burning, numbness, tingling, and weakness will go away. Now, a lot of the times what I'll do to try and check that out is we're gonna feel where the joints are moving and where they're not moving. And so what we wanna do is put a little bit of pressure down on that sacroiliac joint. I should feel it give a little bit or have a little pushback. That tells me it's moving. If I'm not feeling that, it's just kind of stiff and hard like it's hitting a wall, that tells me we need to get that joint adjusted. The nerve that runs through there, that's where some of our sciatica type issues will come from, and that can shoot down our leg. Now, we can have issues like that that stem from our lower back, and we can check out the joint motion through there. We do this. Also, we'll do some other orthopedic exam findings to help us really determine if it's coming from our lower back or our SI joint. X-rays also help us show us that. But when we do determine if it is truly coming from the sacroiliac joint, we want to get that adjusted, and that adjustment is a little different. I'm going to demonstrate it here on Kyle. So Kyle, if you could lay on your side facing me. Perfect. Now, you've probably had the regular side posture adjustment from your chiropractor where they're laying on their side, and we want to get that motion through your lower back. Now, what we want to do differently to really target this SI joint where we might be getting that sciatica from is we're going to do a little lift here. We're going to lift up, good, and we're going to adjust that joint. We're going to get a nice click or pop out of that. It actually feels pretty good right after the first one. It just takes a little while to kind of stabilize that so that joint's moving properly, taking that pressure off the nerve. But that is one of the adjustments we do for sciatica or sacroiliac joint pain. That's all I got for you today. I hope you enjoyed this video.